Good afternoon to one and all. Sai Ram to all of you. It's a pleasure to be with all of you today to share this very important aspect of positive posture. I don't know whether the title which has been coined by the team at UC realized that positive posture need not necessarily mean only the body, but posture can also be how you position your mind during this pandemic of the COVID-19 virus infections going across the whole world. Because I think the mind plays a much larger role in causing problems than the disease itself. The disease kills only about 3% of the people, but how it affects the minds kills a lot more people in their mental status, though not physically. Thank you very much, and I have put together a few thoughts working with Dr. Parthasarathy. We will try and share this presentation with you, and if you have any questions, please save it to the end. You may use the chat box to log in your questions, and we shall try and see how best we can answer them. So I will go to my presentations now. As I mentioned earlier, positive posture during the pandemic is a very important topic from the point of view not only the body but also the mind, how you position yourself during this stressful time of not being able to do all the things that you are used to doing. And we will restrict our talk to mainly the physical aspects of the body, which is how it causes musculoskeletal problems and which can lead to serious issues if we don't correct them early. And it can cause quite a bit of disability as well. So this is just ergonomics, which is an applied science concerning with the design of and arranging things that people use. The common things that we use, like the cots, the mattresses that we sleep on, the tables and chairs that we use, and how we go about sitting in a sofa and things like that. So the objective is how to increase the efficiency and how to do it safely. That is the goal of ergonomics. What has really the pandemic done to you? The pandemic has really made you forcefully sit at home. There are a lot of people who were wishing that we could take a long break and were cursing in the past that they were not able to take a long break. And this has given you the longest ever break that mankind has ever seen. Sitting at home for long hours with no exercise, abnormal working postures, which increases the stress on the body and as well as the psychological stress that it causes if you're confined to the four walls of your house. Over a period of time, people realized it's a strong-minded people started adapting to the situation and started doing some things, exercising, and you have a whole lot of material available on YouTube and other media as to how you should spend your time during this time of pandemic, which has constrained you to your own homes. And how does this affect you physically? It can affect your musculoskeletal system due to bad posture, essentially giving you a lot of discomfort, pain, which can become a chronic issue if you don't address it earlier. It can also affect your eye. As I was mentioning, the posture is both physical and mental, which you have to adapt yourself to during this hard times of being constrained at home. And it has a lot of ill effects on the body. We're going to address some of these issues which are common on what it does to your body. Ergonomics, as you see, is a applied science concerned with designing and arranging things that people use. The common things you use, like the table, the chair, and the cot and the sofas, and how you want to make use of it and not be affected by sitting and lying down in a wrong posture for long durations of time, and thereby increasing the efficiency and the safety of these normal things that we use. what has the pandemic done to us? It has really restricted you to your homes. People who were hoping and wanting to stay home, taking a long break, have got the longest break that they ever wanted. Sitting at home, working for long hours, no facility for exercise. Though a lot of people never did any exercise, suddenly they felt the need for the exercise when it was deprived them. It is like the child not being given a sweet, who always wants the sweet. Abnormal working postures, and which increase all these things put together, increase the psychological stress, and which has a vicious cycle, and that causes more of physical problems as well. How does this affect us? If you look at it, the musculoskeletal system is the worst affected in this because of the bad posture, and it also affects the eye because you resort to reading and the poor light conditions in bad postures, and then there is a lot of eye strain. Reading in the dark with a mobile phone, which is the constant companion of uh, everyone today. And then it also affects you psychologically because of work pressure, family pressure, and the fear of the disease itself has a lot of psychological effect on the persons. What are the common problems that we get to see? We get to see a lot of neck and shoulder pains, low back pains, neurological disorders like nerve compressions in the upper and the lower limbs, and a lot of eye strain because the large amount of screen time causes eye strain as well. We do see a lot of neck and shoulder pains, which is a really disabling thing, though it exists for a shorter duration of time. Low back pain, similarly. I'll ask a question to my colleague Parthasarathy. Do you,
Yes.
do you, can you give us some insight into what would be the numbers of these patients that you will be seeing in a standard outpatient in the rehab centers?
Yeah. Yeah. So at a center like Ramaiah, we see around 70 to 80 patients coming to the orthopedic physiotherapy departments. And every individual clinics also see lots of musculoskeletal problems with the neck and shoulders and low back problems, primarily arising from the kind of work they do and the postures they adopt for long durations and stuff like that, and then the lack of awareness or lack of motivation. So there are so many numbers coming into the OPD clinics to small centers as well as the large centers like Ramaiah and other hospitals.
Okay,
Yeah,
that
any
gives us
small clinic also gives sees around 20 to 30 patients, sir. Yeah.
okay, that gives us a fair idea about what is the volume of problems that we have as a result of this. So usually what happens when you're sitting at home is since you don't have much else to do, so you either use your computer a lot or you use your mobile phone a lot. And a few things happens in sitting and working on a computer because most of us do not have a proper office setup at home. And so the posture of sitting uh, will be very awkward and results in problems. The way we use the computer is something which we need to remember here, as is depicted here, that when you're viewing a monitor, the monitor should be, your eyes should be centered on the top of the monitor and not in the middle of the monitor. So you're always looking down on the monitor, and that is not very much. So the chair is also positioned in such a way that your forearms, when bent at the elbow, are parallel to the ground and at the same level as the table where the keyboard and the mouse are kept. Usually, an armrest is always better to have a keyboard to rest your forearm so that you can access the keyboard and the mouse easily. So the elbow and the forearm is resting on the arm armrest of the chair so that the wrist position is very comfortable. The pictures down below shows how it is so comfortable to rest your hand on the table to use a mouse, so that your wrist is at an appropriate amount of dorsiflexion, which is about 10 to 15 degrees. And this is a very bad position. If you want to, if you're adopting this position where the wrist is extended completely, as it is shown on the picture on the right, you will definitely get problems in the wrist, as well as it may affect the median nerve in the wrist, which is called the carpal tunnel syndrome. So these are some of the ergonomic issues related to use of a computer, which we should remember while using a computer at home. These are some very common bad postures adopted without paying attention to what would be the long-term effects of it. If you sit in and use any of these postures for a few minutes, you may not find any problem. But over a period of time, you will realize that there's a cumulative effect which happens, and people start getting back pain, neck pain. You sit like this, completely bent over, or sit on the bed with the computer on your thigh. Typically, like a laptop, the mandate is meant to be used. That's how it was called, the laptop, to be kept on your laps. But keeping your legs straight at the knee, and then your back is bent, you're going to create a very bad stress on the neck here. And this is a very common problem of people who work for long durations in the kitchen, or anybody else who's standing and working for long durations. Keep your legs straight, which makes you stand far away from your place of work, and that causes bending of the whole spine, and which results in pain and problems with the spine. And here is a very depicting how a bad technique of lifting a weight is seen, with the knee very little bent, but the back is bent a lot more. And then if you lift a weight from the floor in this position, the pressures on the intervertebral discs are so huge that there's a very high chance that the discs will rupture and cause a disc collapse. Somebody needs to mute their mics. Well, the question is, how do we prevent it? That's what we should be thinking of, rather than indulging in abusing the body. We should see how we can correct these postures. I will request Parthasarathy to talk a little about correction of these postures. One of the postures is very abnormal bending of the neck, where the center of gravity should go straight through the middle of the head to all the way to the heel. Here you find excessive bendings. How would you go about correcting it? Partha, can you enlighten us on that?
Right, yeah. So talking about the first image here, the neck posture. So if you see the image there, the image with the white t-shirt, so if you see that there is good alignment of the head, neck, under the upper thorax. I'll just make you understand it's better if I sit here like this. If I'm sitting here like this, if you see, the alignment is very good. The neck, the spine, and the upper body, upper thorax is in good line. That means there is less amount of energy required by the muscles to maintain that posture. Suppose whereas if I sit like this, slouched, the head is falling down towards the ground. So something has to hold your body, something has to hold your head, otherwise you just drop off. So what happens is the muscles are being given more work to hold this head in this position. So the muscles are work more in this position than in this position. So that's what happens. We all have experienced in our lives, whenever we are working, that is unaccustomed activities when we are doing, we are not used to that. So we are, say, recently we had one patient who came to us who, after a very long time, started to wash her clothes a lot. Like, no, there were some 30, 40 clothes she has to wash it in one day, which is not, where she is not used to it. So what happened while bending and working, she made use of her muscles for a very long time than that she can tolerate. So the muscles started to ache very, very badly for her. So similarly, let's say, take for example, the easiest example is the software professional. So if he's sitting in his computer like this and keep working for a very, very long time, what happens is these muscles around the neck, right, the shoulder and the neck muscles, will be working continuously for a very, very, very long time, which they are not supposed to be doing like that normally in normal situations. So the muscle is going to spasms and then you'll get a lot of pain. And there are a lot of other biomechanical factors involved into that. So if you sit straight like this and then work, the amount of energy or the work that the muscles around the neck has to do will be very minimal. So the load on the muscles is less. So the chances for us to get the muscle aches will be relatively low if you maintain good postures. So this posture, I hope you understand. Everybody, all our elders and ourselves, we all know that this is not the right way of sitting. But engage with activities and our work and our lifestyles, we tend to forget. So it is time, or it's always necessary for every one of us to ensure that good posture is very much required to deload your muscles that are holding on to your body parts so that they don't get fatigued and they don't get strained. So first thing is ensure that you have to remember that you have to maintain your neck and shoulders in this position and then work on. And then the second image where the lady is standing against the wall and then working on, trying to recall that the patient goes to the wall and keeps her body there like this, so that upper back muscles are worked, so that your alignment of your upper back gets corrected. If you're like this, if you take that exercise, you go to the wall and then ensure that your whole body from your lumbar spine to the neck and head is in contact with the wall, you're going with good alignment. Alignment is you are in a straight line. Your body is aligned very well in a vertical manner. All right. So and then in this position, you squat, go up and come down. Then you are activating a lot of your core muscles of your lumbar spine and the neck muscles. These core muscles is something that will provide good stability to your cervical, thoracic, and then the lumbar spine area. So doing this exercise, right, frequently, somebody is working at the office, right, or anybody working at home, or anybody who is a housewife, or anybody who is retired also can do these kind of exercises, which will ensure that you assume a right posture, right? So that's something that can be done. Maybe 10 to 15 times, twice or thrice a day can be done to maintain that, right? And the third picture, which is the child's pose, will get you to stretch all your back muscles and hip muscles, right? Will give them some amount of flexibility, right? So that it lengthens the soft tissue. Soft tissue is not just the muscles that are around your back of the spine. It is other fascia, the skin, the ligaments, right? All of those structures will be elongated. So once we have very good flexibility, then work on the other strengthening programs, which we'll be discussing a little later during the discussion part here, right? So good flexibility will allow you to deload some of your tight structures so that they're not stressed out too much, right? So we'll be also showing up a lot of other exercises in the videos, and there will be explanation to that. Yeah. So yeah, at this point of time, I think, yeah. Yes, sir.
Thank you, Partha. That was a good input, and I have just a word of caution in following everything we have shown here, and we're going to talk about. Everything depends on the fitness levels in which you are currently and what age you are. So not everybody can adopt the child's pose very easily. So please be careful when you're doing it. There are some simple techniques which you can use to overcome and reduce your stress on your back and neck when doing these things. Number one is to make it a habit to stand tall. Pretend you're taller than what you really are, and then stretch yourself to make yourself taller. That's one thing, correct. And then you sit correctly with the back rested properly on the backrest, and your thighs placed parallel to the ground at all points of time when you're sitting. the relaxing posture is not a very good idea if you don't have the correct supports under your knees and things like that. And the other thing about working for long durations, sitting in a chair, if you develop any kind of discomfort or if you want to prevent any problem, the thing to do would be to just get up for a few seconds, move around for a couple of minutes, and then come back and sit again. So that will relax the muscles which are stressed. The point is, if your abnormal posture, your muscles are working more and you'll feel more tired because the muscles contraction itself causes a lot of changes in the metabolic systems of your body, thereby making you feel more tired. Whereas if you adopt correct postures, the muscle contractions are balanced and you don't feel so tired. This is one of the reasons why you don't feel tired if you wear a seat belt when you're traveling in a car. If you wear a seat belt tight across the way it is meant to be worn, in addition to being protective against a crash where you don't go and bash against the thing in front of you, it stops or reduces the number of times that you get tossed around while moving in the car. So that is one of the things that one would like to remember while doing all this. So what is the correct posture? You see, there are a number of small, simple things we can do to ensure that your problems, if you have, don't get worse and you don't get problems. While standing in the kitchen or anywhere for a long duration of time, if you can put one foot on top at an elevation of about 6 inches at a higher level than the other foot, that straightens out your back automatically. And you go closer to the workplace, therefore your back doesn't have to bend as much as is seen here. And when you have to sit and read in bed, you support your knee completely very well with a wedge-shaped pillow and make sure even your back is resting on a wedge-shaped pillow. That gives you good support for back, and it will not put your back under stress by flexing it too much. So these are some of the simple corrective measures that we can do and avoid getting into problem. This, as I said earlier, you have the computer related ergonomics. You keep looking straight down into the monitor with your eye level at the same level as the top of the monitor. You have to position your keyboard. You see, it is very nicely depicted here that the armrest of the chair is in such a position that the elbows are resting on it comfortably. Otherwise, what happens is invariably you land up, if the armrests are low, you try to depress your shoulder and then you have to bend your body, and that causes abnormal posture. Or if the armrests are very high, then you elevate your shoulder too much and then cause a problem. Therefore, these are some simple things which you can use to avoid getting into problems as a result of bad posture. Again, the correct lifting technique is, if you want to lift any weight, irrespective of what age you are, even with the younger person, younger people are usually very fond of saying, oh, no, nothing will happen to my back, I'm quite strong. The point is simple. The posture creates abnormal mechanics in the lower lumbar spine, thereby the discs in the lumbar spine are subjected to a tremendous pressure. So the normal discs, the pressure in the normal disc when a person carries a 1 kg weight in front of him with arms extended is almost 50 or 60 times the weight that he is carrying. So there is a quantum of pressure that is transmitted onto the disc in the lumbar spine. So if you bend your knees and lift the weight along with extending your knees and keep the weight close to your body, then the stress on the lumbar spine becomes much lesser. I'm sure all of you who are in the habit of carrying some weight at some point of time in life would have realized that carrying a weight close to the body like you carry a child is less stressful on the back than carrying it away from the body. So those are simple things about lifting techniques. Then we go back to how to address low back pain. You get low back pain is a very common symptom due to bad posture. We call it the mechanical low back pain. And I would request Parthasarathy to enlighten us on that.
So the entire upper body weight, right, has the entire body weight, like from your pelvis up, it is the thorax, the head and upper limbs, has to taken up by the lower limb muscles only. So the connection between the lower limbs and the upper body is mainly the pelvis and the lumbosacral area. So any movement that you do, right, in sitting or standing, any activity that you do, you need to, even if you have to turn, the maximum rotational activity, movement is happening at your lumbar spine area. So when that spine is moving more frequently, right, we don't even realize how many times they are working. So the frictional forces will be a lot in there. So whenever you do any activity or anything in life, we need to have good starting point. We'll be talking about that again later, right? So if starting posture, if it is wrong, like it is the foundation for a building, right? If the foundation is not right, the subsequent components of it will be always distant. So if starting position, starting posture is good, the load on your joints, only your lumbar spine joints, right, and on the muscles and on the ligament, the stress on the ligaments will be very less. So if you have bad posture, the load on your joints, vertebral joints, the load on the ligaments, and the load on your muscles will be more. So when any structure has to take continuous load for a very, very long time, then they get strained, stressed and strained, and they will lose their mechanical properties. So when the joints and the ligaments are not working very well, it is mainly the muscles that have to work more continuously for a very, very, very long time. So when they're working for a very long time with too much load, then they will go into something called as muscle spasms, right? And because of poor biomechanics in posture, some muscles will be shortened. Let's say somebody is sitting in slouch position like this. The soft tissue, the muscles in front of the spine, vertebral column will be very small, shortened, and the back muscles will be in lengthened position. So when there is an imbalance between the muscles in the front of the spine and the muscles behind the spine, then the muscles start aching more. So that's why we call it as a mechanical low back pain. Whenever the muscles are getting strained for a very, very long time and repeatedly they are abused, we can call it.
Yeah, thank you, Partha. I think it's time for your neck exercise videos.
Yeah, okay. I'll just start sharing my presentation, sir. So I have a very short presentation and then a few videos showing some simple exercises that can be carried out by people at home, right? So preamble to that video would be a small presentation from my side, right? So I thought it would be useful to talk about why do we need a good posture, right? So we all understand that good posture is very much required. So from our childhood days, I remember my grandmother, my mother, everybody telling us sit right while you're eating or when you're standing, be straight and stuff like that, right? So we all know that good posture is very, very, very important to ensure that our body functions efficiently, right? So due to various reasons and workloads and kind of work that we do, there is high chance for all of us to adapt wrong postures, right, while we are working. And we work fairly for a few good hours, right? And apart from working hours, even when you stay at home, we tend to sit in wrong postures, as Dr. Sundaresh was showing in various pictures, right? So at home also we assume poor postures. At work we assume poor postures. Sometimes people sitting in the car, I have observed, assuming wrong postures in spite of good seats that are there provided in the cars too. right? And even at workstations as well, in people working on the computers, not necessarily the software engineers. Nowadays, most of us do spend a lot of time sitting and working on the computers. Though we have good chair, there is high chance for us to assume wrong postures, right? So the first thing is that we need to know what is a good posture and why do we need a good postures. Yeah, earlier it has been explained that what is a good posture in sitting and standing. Yes. So why do we need a good posture? The explanation for that is like, if any person is standing straight, the amount of, I explained that already, the muscle work required to for you to stand in good aligned position is very less. We all can assume such some standing postures. I think you all can try doing that if you can now. Stand straight and see how much are your muscles working. And then slightly stoop. If we stoop, we'll realize that our muscles are being challenged more. In a wrong alignment, poor posture, our muscles have to work little more than necessary. When anybody works little more than what is normal, they tend to fail. They don't fail immediately. They're strained for a very, very, very long time, for years or months, depending on the kind of activity and the various other parameters in individual's performance. Then they get strained a lot. Whenever we get strained, more load is given, you tend to get aches and pains, right? And many of the activities, mainly the sitting activities or any activity, any kind of routine work that they do with their upper limbs, the chance for us to protrude our head and shoulders will be little rounded and thoracic. I'll sit like this and show you, right? You tend to go down like this with your
Dr.
thoracic.
Partha, sorry, may I interrupt? I think your video is off, so we are missing.
Is it? Okay. Yeah, let me check it out. So what I was telling is, a good posture is, like I said earlier, sitting straight. Bad posture is whenever we all work with both our hands, most of all the activities, right? We work in front of us. So the chance for us to go into poor postures like this, getting your neck down and head forwards, and then rounded shoulders like this, then upper thoracic cage, upper spine, upper back going down like this is very too much, right? Always, right? So what happens when we go like this? The structures in front of your body, your pectoral muscles, you tend to go like this. If you stretch it out like this, you feel a lot of stretch here, and sometimes some people, if it is very bad, you get pain as well. That is because of assuming poor postures like this for long times when you're working and all of that. So the intention is, even the wall exercise there when we showed, so go to the wall so that you strengthen up your upper back muscles and all that, right? So a good posture is very much necessary to deload your joints of all your spine and upper limb and lower limb joints as well, cervical spine, back and lumbar spine. To deload them, we need to have good postures. To put little less strain on the ligaments that are supporting your spine, we need to have good posture. To minimize the work on your muscles of your back, pelvis, upper back, neck, trunk, the lumbar spine, the lower back, and in your pelvis, we need to have good postures. So I'd like to repeat these points. Why do we need a good posture? We need good postures in order to deload the forces on the joints, to put less strain on the ligaments. Ligaments are soft tissue which will provide stability to different joints. All the joints have the ligaments, right? So we should not load those ligaments too much. Deload the ligaments and give less work to your muscles that are holding your body straight. So if you can take care of these things by assuming a good posture, the chances will be less, way less than when you assume bad postures while you're working or in your day-to-day activities. That is, I think these are valid reasons why we need to have a good posture, right? So now I'll start sharing my screen, right? This is somebody working at home. If you see his posture, they're sitting, right? He's not having a right workstation, which is the current situation for everybody, right?
I'll go back to the video, the starting point. If you see here in this video, you see his spine, the lumbar spine, and his upper back and neck is more protruded and is in slouched position, and his elbows are not in line, and his screen is not in line with his head, with his eyes, right? So these are all the reasons why we get issues with the neck and shoulders and the upper back, right? So then we have small corrections in this sitting posture while working with the computer, right? So you always tend to protrude your neck more and more while trying to reach. So here is the other position that he has adapted. Is my physio working with us, right? So what he has done is he tried to raise the height of the screen. That is still not right enough. The upper border of your computer screen should be at your eye level at least, and system should be at an arm distance from your body, right? And he tried to raise the height of the laptop by keeping the books in there. You'll have to further raise it up so that the upper border comes in line with your eye level, right? So what he has done is he has got a small pillow behind his back to ensure that his lumbar spine is aligned well, so that the load on the muscles will be less. So otherwise he'll be more slouched. Because of the addition of the pillow, right, and a little modification with the laptop, there is automatic correction to some extent to sit a little more straighter, right? So the adding some cushion to the lumbar spine makes some kind of additional advantage there, right? So other modification is done is he tried to use the mouse instead of using the keyboard of the laptop. Yeah. So this is other one awkward positions when a lot of us tend to work at homes, right? There is a cozy sofa there at home, and then you tend to sit like this and then work, right? So even here the spine is badly disturbed, right? I mean strained a lot. And look at his cervical spine, the neck region. He has to even that part will be more strained in there, and his forearms are not supported. That will give an additional problem. So what is it that little bit we can do to modify so that you can work in these postures is the next part of the video here. Yeah. So here what he has done is he has pulled himself back to the edge of the armrest of the sofa there, and added a small cushion back in there. So ensure that the hips and your backrest, there is not much space in there. If you slide down further, there is more space between your hips, pelvis, and the backrest of anything that you are sitting. So here he has added a cushion back in there so that he gets more support, and which in itself will make him sit a little more erect, but at the cost of strain on the neck. So this kind of posture eases out the lumbar spine and the upper thoracic spine, upper back and the low back, but continues to load the neck region, right? So this is not the ultimate of it, but this is a better version of sitting in the sofa like that. This is other one more position that we all assume, right? So they are similar to the previous component of it, but people tend to work on their beds like this, which will load the spine, entire spine area. So this working at home, we thought it would be relevant in here because many people are working from home now, which where they need to adapt or find ways or modify their methods of sitting postures to work and all of that. So we thought that we can do some modifications in not so convenient environments as well. Hold on, I'm opening up my PowerPoint again. I think it will take a few more seconds. In the meantime, we'll talk about the postures that we can adapt at home, right? So one of the best places to work on computer at home is I advise you to use your dining table, right? Your dining table, so that you can place your laptop or your systems, any other systems that are there, or any other table that you have got, the point that you need to keep in mind is you need to pull your chair closer to the table. Do not be far away from it. Be closer to the table so that there is hardly maybe 5 to 6 inches between your chest and the upper border of the table, right? And you have to move your computers little away so that you maintain some arm distance from your computer to your body, right? That will give you some kind of less strain to your eyes as well, keeping it at some distance. I think you can see this video. Yeah, this is the video for
mechanical low back pain. So we, before we start the video, I would like to suggest you all, we advise not to do these exercises when you have radiating pains. Okay, that pain down from your low back to the legs. Okay, you would need medical advice from the orthopedician or meet your physiotherapist, right, to do some exercises, right? So when there are no radiating pains and there is no weakness in the toe movements and all of that, and if it is simple mechanical back pain where the lumbar spine, low back and upper back are hurting, we can do these exercises. So this is to stretch your pelvis muscles, yeah, okay, your buttock region area, the muscles there, gluteus muscles. Then the simple pull, stretch there and hold for 5 to 7 seconds. And while doing the exercises, you should not get a lot of pain. A gentle pull is good for these exercises. So this exercise is bend your legs and pull in your lower abdomen towards the bed, okay? And the pelvic bone turns towards your side, okay? That is for your simple core exercises of your low back muscles, right? And we'll share it to the organizers so that they can put it up in their YouTube channel as well. The simple basic abdominal muscle strengthening exercise. We're not asking you to go all the way up. Just try to raise your head up so that your shoulders are partially cleared off the ground. One is going straight, the other one is going to the opposite sides. This is to strengthen your lower back muscles. This is for lower abdominals, basic simple strengthening exercise. Right, you just go up there and then come back. If there are some concerns, to avoid this exercise. This one is simple bridging one to strengthen your low back and then the hip muscles, which will provide good stability to your lumbar spine and pelvic area. Start now. This again is for low back exercises. You lie down and then keep your hands at the shoulder level and then push up very gently. Right? So this should not aggravate your pain in the lower back area. You should do to the range where you are very comfortable. Somebody who is comfortable with the previous exercise can progress to these exercises. Just raise one hand up and head, and then if you're comfortable, and then the lower limb, then if you're comfortable with this, we'll go to the next sequence of exercise. Next one is simple cat and camel exercise. Okay, no. The other one is pulling. You can pull in your tummy a little bit while doing this exercise. Pull the tummy in and then raise the hand up. Then pull the tummy in and then take the leg back. Somebody who is not able to assume this position, please just try to sit, go on all fours for some time and then progress to the next steps. Maybe it is advised if you have some imbalance to have some supervision, somebody next to you at home, right? If you're able to do all of these exercises, then we can go to the last posture which we have shown, we'll be going to show you here. This is called as the cat and camel, which will stretch your structures front of your spine and the back of your spine. If you're able to do all of this, you can assume this posture, which will facilitate lots of flexibility in the upper back. Yeah, so? Okay. We'll show you this for the low back, and we have one other video for the shoulder and the upper back. Shoulder and upper back. We kept shoulder and upper back because the muscles around the shoulder and upper back are very closely related muscles, so that it will help both the shoulders as well as the upper back muscles to strengthen and as well as to achieve flexibility of those muscles. We've just shown only one repetition so that we can have more exercises coming up here. The exercises that are going to happen now are one of the most important one. Okay, take your hands up and then take them back together as much as you can at different angles. You have to get your shoulder blades together, close together to each other, and you can hold there for 5 counts if you can, right? Hold there for 5 counts and then repeat it. The shoulder blades should come closer to each other when you are doing those exercises. This is the band exercise. We have only a couple of band exercises here, right? This is again for your upper back muscles. Upper back muscle strengthening is very, very important in order to have good postures. The upper back posture isn't great, the cervical postures will automatically get disturbed, right? These are all the simple exercises for the shoulder and the upper back. Always have your thumbs pointed towards the ceiling. Do not have them the other way around because that will cause other additional problems, right? Always have the thumb facing the ceiling while doing these exercises. One is sideways and other one is forwards. This is a very good exercise for your shoulder and your upper back muscles. Okay. And these are the simple stretches. Okay. Keep your arm close horizontal to the ground. The other one is taking it up and take it back towards this wall there. And the other one is stretching your side muscles, side of your spine. Do the side also. Okay, that was it. Yeah. Then we have some more exercises for your lower limb muscles, simple exercises for the knee pains. While doing standing exercise here, please hold a chair next to you. Ensure that you're standing straight while you do these exercises. This is forward leg lift. Yeah, this is called as forward lunge. The behind leg, the heel should be on the ground. Yeah, turn to the side. Hold the chair while doing these exercises. Ensure that your body is aligned when you do these simple exercises. We are working on all the muscles of the lower limb. When you're trying to exercise the knee, it is not that we have to treat only 2-3 muscles around the knee. We need to ensure that the entire lower limb muscles are strengthened so that we can deload the knee joints. So this is a very raw video. We tried to record it 2 days back. This is for this webinar. Yeah, the other one is the important one. When you sit here like this, have a ball between the knees and hold the ball and then try to lift the leg up. One important muscle group of your quadriceps will get strengthened doing that exercise. Then on your lying on your back, just start off with your foot movements, right? Take them up as much as you can, and then move down as much as you can. Then simple knee bending exercise. Yeah, you can bend it as much as you can. Try to bend more if you have some restriction. If it is too much painful, to avoid bending more. Do to the range that you are comfortable with. Other one is, I think this exercise some of this exercise everybody will be doing it. We're just trying to reinforce it. So when you're doing this exercise, especially, we want you to press the knee so that the heel comes off the couch. It has to come off the couch, right? Next is keep the knee straight when you lift the leg up. If the knee is not straight while lifting up, you are putting more strain onto the knee joint. Ensure that pull your kneecap up, make it tight, and then lift the leg up. That is important. And lie down straight when you do this, and the leg has to go up straight. And you can do this 10 times. To strengthen it further, you can lift it up and then hold there for 5 counts and then come down. Here, bend the knee as much as you can. You can take assistance of others to take your heel towards your buttock region. Very gently, of course, not to give pain to the knee joint. This is for gluteal muscles, your buttock muscles. Lift it up and hold it there straight. While you are lifting it up, ensure that your lower back is not rotating. Lift it to a point that you are comfortable with. I show the neck exercise on myself so that we get some idea, right? Okay, yeah. Here again, the caution is, please, if there is any pain radiating down your arm, if there is any burning pain, tingling, or pricking kind of sensation coming down your arm, please don't do any exercise until you seek some attention, right? Talk to the specialist, then advise, then please adapt the basic exercises, then the progression happens. These exercises are for those people who would want to prevent the pains to come to, to experience pain, or to those people who have some mild tightness and pains in this region, the neck region and the shoulder, upper shoulder area and upper back areas. You can definitely do these exercises. Preferably not when there are red flags. Red flags are radiating pains and any weakness in the hand with neck pains. Please do not do the exercises. Yeah. Let's start with some 3 exercises. Okay. We all know these exercises. We're just reinforcing them, right? Yeah. Sit straight. Do not start your exercise sitting in a bad posture. Do not sit like this and then start exercising. It will be adding on more problems if you exercise like that. We want you to assume the right starting posture, the right sitting position, or you can do it in right standing posture as well, right? Never in a bad posture. Any exercise for that matter. Never do anything in wrong postures, right? Always, to the best of your abilities, assume your best postures to your knowledge and then start exercising. While doing this exercise, I do not want you to turn your shoulders while exercising. Just turn your head towards the right side, okay? Trying to take your chin towards your right wall, right? And then to the left side. When you go there, you'll find some amount of stretch in here. You can stay there for 4 to 5 seconds or 8 seconds as well, right? And then come back, okay? To the right and then to the left. The next one is, again, the neck, your head should be in good alignment here. Right? Not start off in this position, right? The other exercise that I'm showing you. Try to touch your shoulder with your ear, right? Keep your head straight and then touch type, right? Okay, right. And then to the, see, while I'm bending, you should not turn like this and then bend. Keep your head straight, your face in facing this wall without rotation, and then bend it to this side, right? Okay. Next is bending forwards, especially with bending exercise. Some people who have this radiating pain mild also, when bending, if it is radiating more, please avoid this exercise, right? And then look up, okay, as much as you can, right? Look at the ceiling, down, right? And then along with that, I would suggest you to do your shoulder rotations, right? It appears this is only for the shoulder, but the neck and shoulder are highly connected. Connected in the sense, the muscles that are rising from your neck only go to your upper shoulder areas, your shoulder blade and all of that. So we need to ensure the neck muscles along with the shoulder muscles should be very relaxed and be active. Rotations forwards and the other side, other direction like that. Okay, right. Then after doing these free exercises for 10 to 15 times, we would advise you to do some stretching exercises. Stretching is with your right, if you're bending to the left side, okay, left side, want you to hold the chair, leg of your chair, hold it there, and then bend. Again, your ear to the shoulder, right? And you can hold your head here, and then gently stretch it. You'll feel mild stretch there. You can hold there for a few seconds, 5 to 6 seconds. And release slowly. And then keep your head straight there like that. And then with your left hand, hold the chair in there. We have to hold the chair leg there, primarily because while doing this, if your shoulder comes up, we don't get the effect that is expected out of this stretching exercise. So you want you to hold the chair there very gently and then stretch it. When you are holding, the shoulder doesn't come up like that. It stays in there. Okay, gently stretch there. And the stretch should be at your comfortable level. Do not think that the more we stretch, the better it is. It is not so. The stretch should be pleasing kind. You should like that feeling, right? Nothing like, no, the more we do, the better it is. That's a wrong notion in here, right? The other important stretch that we need to do is, I want to do all this stretching exercise maybe after a walk for 10 minutes and then after doing some free exercises, if you do stretch, it is more better and it is advised that way, right? Yeah. So other one is important one is I want you guys, anyone who is doing this exercise, to turn your head to 45 degrees. This is complete rotation. I want you to turn to 45 degrees. Hold your head here, and the other hand will be holding the chair there, and your head should go towards your opposite hip joint, right? Please remember, do not go like this and then do this exercise. It appears you're doing it very well, okay? But it is not wrong, and you shouldn't be doing it like that. Sit straight. Always remember, starting point, good posture. And turn to 45 degrees. Hold your hand in here, and take your hand towards the opposite side of your head there. Then gently stretch it. Pull it down as if you are taking your head towards your left hip joint. Okay? And again, you should be comfortable stretch, not something that is disturbing. And turn to the other side, do the same exercise. All right? So before doing these stretches, I advise you can take some hot bag. Okay, hot packs. We all have hot packs, right? And again, heat should be that is for your comfort, right? It should not be too hot. Okay, you can use any form of heat that is feasible to you at home, right? Yeah, do not take too much heat that can cause skin burns and all of that. We all take the precautions, I understand. Okay, place it your the hot pack to your upper trapezius muscle to the right and left side, and then do this exercise. It is more better, right? And the other exercise that we would tell you is, right, you're sitting straight like this here, and gently retract your chin towards your spine area. A gentle retraction. We do not want you to do like this too much. Okay, this is normal sitting posture here with good alignment, and I just want you to go there like that. Hold there for 5 counts and then come back. This is for your neck core muscles, right? Core muscle is something that will hold your spine well there. Go back, hold there for 5 seconds. 1, 2, 3, 4, 5, relax. Go back, relax. Okay, remember, while doing these exercises, if you can hold your scapula, you can hold your shoulder blades together like this, and then exercise, it is more beneficial. Okay, I hope you got this point, right? While trying to do your neck exercises, if you can hold your scapular blades together back there, and then do your exercises, will have better benefits, right? Okay, so yeah, I think these are the exercises for the neck. Okay, it would be relevant for us to show you the exercise for the neck, the upper back, the lower back, and then the lower limbs, because if you ensure there is decent amount of flexibility. And then if you remember that this is the right sitting posture, if you follow the advice given by Sundaresh sir and the other videos that showed the right postures that we demonstrated, there is very good chance that we can minimize the chance for you to get these mechanical pains in the neck, shoulder, and the back as well. Right? Yeah, that's from my side, I think. Yeah.
So all these things have been addressed by exercises, shoulder pain, bad posture, and all. So the last part of it is, what is the role of medications? Yes, the role of medications is there only when you have a very acute pain and you need, you need to get some relief out of it. When you have severe pain, please do not do any exercise without consulting a doctor. And I think medications will play a role during the acute phase and for short durations of time. But the point one needs to understand is that this is an imbalance in the whole musculoskeletal system, which has been designed so beautifully by God to maintain a correct posture. And it is unfortunately a part of our evolution process which has made us erect instead of being on all fours. Our ancestors, the apes, did not have any of these problems because they are on all fours. Their backs are very well supported. We had to go back on two limbs, and therefore we have all these problems. So therefore, it's a very balanced way in which this has been made, and we create the imbalance by going into bad postures. So I think we should pay attention to that and take medications only on the advice of a doctor. And if your pain is continuous and if it's causing you a radiating pain, the reason why you get radiating pain from any part of the spine is either the neck or the cervical spine, lumbar spine, or the thoracic spine, is because inside the spine is the spinal cord and the nerve roots which come out to innervate your muscles and give sensations to the rest of your body. And these nerves get irritated by some pathology, and therefore you may be getting pain. When you have such a nerve root problem, I think it's not advisable to do any of these exercises which have been demonstrated as of now. So I think with this we come to an end of our presentations.